Having finished COVID-19 pandemic, many people still suffer from weird symptoms. In this video, we would like to speak about Lyme COVID-19 symptoms, its association with COVID-19 vaccination, and its treatment.
Post-COVID-19 condition. Hello everyone, welcome to Lancet Summary YouTube channel. Dr. Salamati, could you please explain what we are going to talk about in this session?
Actually, COVID-19 pandemic finished about 2 years ago. However, we as physicians still face some awkward symptoms among our patients who had been infected during the pandemic. Let me read some of the patients' statements. Number 1. I could not remember how to spell words. I also found I was missing words from sentences and sometimes writing things that did not make sense. Number 2. I felt lost driving and had to stop and find my position in a GPS to be able to drive back home. It's a route I have done hundreds of times. Number 3. My husband was sleeping for about 20 hours a day. 20 hours out of every 24, and he's still sleeping now. 5.5 months after, he still sleeps an awful lot. Sat up, not lay down. Sat up, he's just totally exhausted. So, I think we need to speak about the status called post-COVID-19 condition or long COVID.
Would you please introduce this session's paper?
The title of the paper is Post-COVID-19 Condition, Brain Fog and Fatigue. What do we know now? And the type of the paper is editorial of eBiomedicine Journal, which is one of the Lancet family journals, and it was published in July 2024.
And could you please define long COVID?
To be more precise, the American Academies of Sciences, Engineering and Medicine defined recently in June 2024 long COVID as an infection-associated chronic condition that occurs after SARS-CoV-2 infection and is present for at least 3 months as a continuous, relapsing, and remitting or progressive disease state that affects one or more organ systems.
Dr. Heidari, would you mind elaborating on this part a bit more?
Of course. It may be a little vague for our audience. By what do we mean when we say relapsing and remitting? A relapsing and remitting disorder means the symptoms are at times worse, meaning relapse, and other times are improved or gone, meaning remitting. Dr. Salamati, what is the importance of long COVID and what do you mean when we say brain fog?
The World Health Organization reported that since 4 years ago, which COVID-19 pandemic has begun, still about 10% to 20% of infected people have some symptoms and signs of the disease. And among the symptoms, brain fog and fatigue are the most common symptoms. Brain fog means poor memory, difficulty thinking, and difficulty concentrating. A study which was published in eClinical Medicine in March 2024 showed that about 5.8% of the participants, the patients, had both brain fog and fatigue 9 months after infection. The research showed that cognitive deficits were more common among the elderly, males, and those with less than 12 years education. It also showed that fatigue was associated with headache and depression.
Dr. Heidari, could you please mention other clinical manifestations that might be present in long COVID?
Certainly. People with long COVID can have a variety of symptoms that may be similar to symptoms of other illnesses and can last weeks, months, or even years after COVID-19 infection. Fatigue, brain fog, and post-exertional malaise are the most commonly reported symptoms. Other commonly reported symptoms are fever, shortness of breath, coughing, chest pain, heart palpitations, headaches, loss or change in smell or taste, depression or anxiety, diarrhea or constipation, and joint or muscle pain.
Dr. Salamati, does vaccination against COVID-19 have anything to do with the long COVID?
Absolutely. Many studies showed that COVID-19 vaccination could decrease severe forms of the disease, drop the mortality of the patients and the disease, and decline infection transmission through communities. Furthermore, a multi-center study which was published in the Lancet Respiratory Medicine in March 2024 compared 10 million vaccinated with 10 million unvaccinated people. The research showed that vaccination could decrease the risk of developing long COVID. However, another prospective study, which was published in scientific reports, evaluated many patients 6, 12, 18, and 24 months after infection, and they found no differences of the related symptoms among those who had been vaccinated and those who had not. Likewise, there were no differences based on the number of vaccine doses which they had received. In other words, these two great studies showed that vaccination prevented developing long COVID. But if somebody had been infected, the vaccination status would not have changed the developing of long COVID.
Well, is there currently a cure for this long COVID?
To be honest, up to now, there is no full cure for the patients, particularly its brain fog and fatigue. Nonetheless, there are a host of inspiring studies working on the subject. As a result, perhaps in the near future, scientists might develop new medications.
Dr. Khavandegar, could you please elaborate on this a bit more?
Well, we know that currently there is no standard cure or agreed cure for this issue. However, there are efforts underway to address this issue. For instance, the Recovery Initiative in the US has started investigating different management treatments which have potential to address this issue, and they realized, for instance, that low-dose naltrexone is both efficient and safe and can improve the recovery in long COVID. And that's it. Thank you for thorough explanations and your time. Once more, the goal of this YouTube channel is to provide a summary of medical hot topic recently published in the Lancet journals. Don't forget to like this video, leave your comments below this video, and subscribe to our channel.